You have schistosomiasis. Are you experiencing diarrhea, abdominal pain, bloody urine, fatigue? You likely have schistosomiasis. Doctors don't want you to know this. Schistosomiasis is a chronic inflammatory disorder that is initiated by blood fluke of the genus Schistosoma. The life cycle of schistosomiasis basically starts with free-flowing Saccharia in the river that penetrate the human skin, and we find this adult worm in portal and pelvic veins of the human beings. Then you have the human beings passing their ova in feces and urine. Then you have this ova hatching into meracidium, and the meracidium infesting the intermediate host, which are the snails, and the snails will release the Saccharia back into the river. The epidemiology of schistosomiasis: we have Schistosoma hematobium in Africa and in Middle East. We have Schistosoma mansoni in sub-Saharan Africa, and in South America you have Schistosoma japonicum in China and Philippines. You have Schistosoma intercalatum in DRC Congo. You have Schistosoma mekongii in Cambodia, Schistosoma guinensis in some part of West Africa, Schistosoma mati in France. The etiology of schistosomiasis: we have Schistosoma hematobium, also called the bolinus. We have Schistosoma mansoni, also called biomphalaria. We have Schistosoma japonicum, also called the oncomelania. We have Schistosoma guinensis. We have Schistosoma intercalatum. We have Schistosoma mati. And finally, we have Schistosoma mekongii. Pathogenesis of schistosomiasis. How does schistosomiasis come about? It is all about immunological response to the ova of the schistosomiasis parasites. So you could see that we can have some reactions like the macrophages, the eosinophils, and some cytokines responding to those ova from schistosomiasis. Clinical features of schistosomiasis. How do you identify schistosomiasis? You have Kaburi itch that comes from cutaneous irritation of Saccharia. You have Katayama fever, which consists of various symptoms that you need to know about, like fever, like cough, like asthma-like symptoms that starts 2 to 4 weeks after exposure and subsidizes over some months. And you could finally have this enlargement of your liver, enlargement of your spleen. You could have dysentery. You could have lymphadenopathy, which are the enlargement of your lymph nodes in your body. Dysentery, hives. The intestinal schistosomiasis. What do you see in the intestines with schistosomiasis? The lesions here are caused by Mansoni and Japonicum. Yes, which site have been involved? Colon, appendix, small intestine, rectosigmoid. The features that we find: appendicitis, diarrhea, dysentery. Yes. What do we see? What do we see? So we see petechial hemorrhage in mucosa and the submucosa of this intestine. This is what you see. And this is what you see. You see the granuloma with fibrosis in the intestines. You see the multiple inflammatory polyps associated with dysentery. You could have the anal and perianal polypoid masses in your anus. And you could have bilharzioma, which are inflammatory masses with ova, seen mainly at the mesentery and intestinal serosa. The hepatosplenic schistosomiasis, it means what happens in the liver, what happens in the spleen with schistosomiasis. So basically, it is all about these ovas that are carried to the liver through venules, leading to the portal circulation, whereby you have this ova deposited in the liver that lead to granuloma. In the liver, what happens in the liver? We have this and macro or micronodular livers. We have portal fibrosis, which are also called the Bilharziasis pipe stem fibrosis. And you could have these microscopic changes in the liver, whereby you have portal fibrosis plus many ovas. And you could also have areas of dense fibrosis. You will have the bile ductal and arterial, but you will not see the veins. You will not see the venules. And you have many dilated capillaries. That's with the liver. In the spleen, what happens in the spleen? You have this reactive splenomegaly, which is the enlargement of the spleen. You could see it here. And you could have the fibrocongestive spleen. The changes that happen in the spleen. You could have the adult worm in the splenic vein. What happens to the bladder and the genitals in schistosomiasis? Urinary bladder and the genitals react to over-deposited to them by this schistosomiasis, and it is mainly the S. hematobium and S. mansoni. And you could also have the futures, which are bilharziomas, terminal hematuria, and sandy patches on your bladder trigon. What do you see? We see cyclomoval granuloma. We see this diffuse inflammation at the bladder and genitals, over-inflammation at the cervix, prostate gland, and the salpinx, seminal vesicles. You have this squamous metaplasia of the urethelium, of the urinary tract. You will have dysplasia. This is what you see, a malignant transformation. It means that it could transform into cancers like the squamous cell carcinoma, the transitional cell carcinoma, and the adenocarcinomas. Treatment of schistosomiasis. Basically, all forms of schistosomiasis are being treated with Praziquantel. All forms of adult schistosomiasis are treated with Praziquantel. This is the first line treatment. Subscribe to XpertMedix on YouTube, guys, for tips like